Before starting cyclophosphamide therapy, medications such as gonadotropin-releasing hormone (GnRH) agonists are often used in females to induce temporary anovulation. The goal is to protect ovarian function and reduce risk of ovarian failure. Common GnRH agonists include luprolide, Lupron, goserelin, Zoladex, triptorelin, Decapeptyl. These medications suppress ovarian function by downregulating the release of gonadotropins, LH and FSH, putting the ovaries into a temporary state of rest, which may help protect them from the toxic effects of cyclophosphamide. In Egypt, the trade names for the GnRH agonists commonly used for ovarian protection before cyclophosphamide therapy include luprolide, Lucrin Depot, goserelin, Zoladex, triptorelin, Decapeptyl. These medications are typically administered as subcutaneous or intramuscular injections, depending on the specific formulation and dosing regimen. The dosage forms of these GnRH agonists in Egypt for ovarian protection before cyclophosphamide therapy are as follows. 1. Luprolide, Lucrin Depot. Dosage forms 3.75 milligrams once monthly, intramuscular or subcutaneous, 11.5 milligrams every 3 months, intramuscular. The choice of dose depends on the duration of the cyclophosphamide therapy and the clinical situation. 2. Goserelin, Zoladex. Dosage forms 3.6 milligrams implant every 28 days, subcutaneous, 10.8 milligrams implant every 3 months, subcutaneous. The monthly dose is typically used for shorter treatment durations. 3. Triptorelin Decapeptyl. Dosage forms 3.75 milligrams once monthly, intramuscular, 11.25 milligrams every 3 months, intramuscular. Similar to luprolide, the dosing schedule depends on the patient's needs and treatment plan. These injections are typically initiated 1 to 2 weeks before starting cyclophosphamide therapy and continued for the duration of the chemotherapy to ensure ovarian suppression throughout the treatment period. Here are the approximate prices of these GnRH agonists in Egypt. Prices may vary slightly depending on the pharmacy or location. 1. Luprolide, Lucrin Depot. Lucrin Depot 3.75 milligrams, approximately 2,000 to 2,500 EGP per injection. Lucrin Depot 11.25 milligrams, around 5,000 to 6,000 EGP per injection. 2. Goserelin, Zoladex. Zoladex 3.6 milligrams, approximately 1,800 to 2,200 EGP per implant. Zoladex 10.8 milligrams, around 5,000 to 6,000 EGP per implant. 3. Triptorelin, Decapeptyl. Decapeptyl 3.75 milligrams, around 1,500 to 2,000 EGP per injection. Decapeptyl 11.25 milligrams, approximately 5,000 EGP per injection. These prices can fluctuate and might be subject to changes in availability, import costs, or regional pricing policies. It's advisable to check with local pharmacies for the most accurate and updated prices.